Well, welcome to the Missouri Healthy Schools Podcast Live. My name is Dr. Guy Danoff, and I'll be your host over maybe the next hour. And we're going to be talking about a really interesting topic, as we're going to be talking about behind the care, how Missouri school health programs empower our school nurses. And we've got a great group of panelists this evening. We're going to start with Kelly Vaugh. And Kelly, I want to start with you. And if you could, tell us a little bit about your background, as I know you work with the Department of Health and Senior Services.
Yeah, so I am the school nurse specialist for the Department of Health and Senior Services. I started my background in a small rural school in Missouri, and then lucked upon this job, and I have never looked back. I love it. I love taking care of the school nurses in the state, and couldn't find myself in a better place. So
that's exciting. Well, I know we're going to unpack a lot over this next hour. And we also have with us Elissa, otherwise known as Eli Brueggemann. You like that? That's the sport announcer voice coming out in me. And so it says here that you're the state school nurse consultant, also for the Department of Health and Senior Services. And Eli, tell us a little bit about your role and what you do.
So I recently came into this role this September. And prior to that, I was a school nurse for a St. Louis suburban, rather large school district. And I was in that role for 12 years.
Okay.
Primarily in the elementary level. So, but recently had the amazing fortune to come into this role with the HSS as the Missouri State School Nurse Consultant. And, I like to say that we're the people that help the helpers. And I love that. I love that we can support school nurses and school health programs across the state and reach out directly and work with everybody and support their specific needs. It's an amazing role, and I'm truly blessed to be in it.
Well, congratulations certainly on that new role. And if you're new to our podcast, I'll tell you what we do here at Missouri Healthy Schools Podcast Live. We basically highlight our people or our guests, certainly the programs that they're involved with, and even partnerships, which is all about trying to improve student health across our state. And particularly tonight, our episode is going to look at the heart of school nursing right here in Missouri. We're going to be discussing the impact, the challenges, and yes, the incredible stories behind the work of our nurses and what they do every single day. And with that, Kelly, I'm going to have you speak to this statistic, because I just want our audience to see just how huge this is.
Yeah, so in Missouri, more than 500,000 students are supported by school nurses, and they manage chronic conditions, provide emergency care, they conduct your screenings, and they also collect the valuable data that guide us for public health decisions. So everything that they do is directly correlated to every student in every school.
Eli, anything you'd like to add to this?
Just that even the smallest of actions that a school nurse does, simply because it's their job, translates to meaningful data. Every little thing that a school nurse does means something, and every little connection they have with a student or a family, it's truly meaningful. And as Kelly said, everything translates into data. And
right.
If you're a school nurse that's out there doing all these little things simply because you're an amazing nurse, you should be mindful of all those little things you're doing, and keep track of those things and be proud of those things and brag on yourself, because as school nurses in general, we know that, if we don't speak up and say what we're doing, nobody knows. If you don't document it, it didn't happen.
Right.
I would add to Kelly's comments just to say that, every tiny little interaction that just seems every day to us is truly meaningful to a student and their families, and it does translate into meaningful data at some point.
Well, what I thought we would do is we got 3 segments, and I'm just going to throw this out there. If you're a live viewer and you want to ask, either Kelly or Eli a question, or both of them, feel free. Or if you'd like to make a comment, feel free, because we're on YouTube and you can just drop it in the comment. I can bring it on the screen, and we can make this a very interactive live experience. So the very first segment we want to talk about is the role of the school nurse. And I'm going to throw this question, Eli, to you first, is when you think of the role of school nurses, what myths do you think exist right now that people don't understand? Because I got to tell you, when I was prepping for this segment, I got to tell you, I got really excited because I was thinking, I don't think a lot of people really truly know what you all do.
Yeah. I think the biggest myth in regards to school nursing is that it's easy. Is that it's just some sort of like end of career, step in, write it out, throw on some band-aids, that it's just sort of this easy, just sort of sit back and enjoy it kind of job. It is not easy. I always said that when I was in school nursing, that we were like the PUC. We were like the pre-urgent care, right? As you're funneling down a situation, parents would often be like, go to the school nurse and see what she thinks. And then we'd be like, that is clearly broken. So we oftentimes we're that first line of defense.
Right.
And like I was, when I was thinking about this question earlier, like there's a Rolodex happening in my head as I'm assessing a student, be it the tiniest infected hangnail that might actually be a staph infection.
Right.
Biggest, oh my gosh, this might be appendicitis, so like as we're assessing kids, we are truly relying on all of this school nursing and nursing background.
Right.
Constantly pulling, what this might be, truly by assessing, it's not easy. You have to know something about everything as a school nurse, and you're responsible for everybody in the building. So, that's a heavy lift.
It is, and Kelly, I want to start with something kind of funny. Then you can certainly talk more about the myth. But this is kind of funny. When we were talking at our prep meeting, I love what you said when I asked you about this question, and you're saying, "Well, Guy, you'd be surprised how many times a teacher will send a kid our way, and like they're talking about how they've got this nosebleed and it's gushing." And a lot of times, what happens when they get to your office? This is pretty funny.
Oh, it's like a napkin with like a dot of blood on it. Like, I'm like, what?
So how do you go from blood gushing to a dot?
Oh, and I'm all gloved up, like ready, got everything ready because this kid's coming down the hallway bleeding, and then he turns the corner, and I'm like,
you're standing at the door waiting. You're like, all right,
all right, let's go. No, nothing.
So Kelly, from your, I know we just want to be funny, although that is true, although that is a true story, but from your perspective, what do you think is the biggest myth that people have about the role of the school nurse?
Well, I came from the ER, and when I told all my you work in like a cohort, and when I told them I was going to school nursing, they said, "Oh man, you're going to get to read newspapers every day and magazines and eat candy, and it's going to be so easy." Such a myth. It's not easy, and not only did I never get to eat candy or read anything besides medical records, I never got to go to the bathroom. I never got a drink of water. I never got lunch. Right. So there was all kinds of myths in there. Yeah.
Wow. All right. So what else would you guys like to add? Because I think that people don't really realize how you are the connection between healthcare and education in your school.
Yeah, definitely. I think what a lot of people don't realize too is that school nurses are public health professionals. Mm-hmm. So we're the people who are connecting healthcare and education. Every kid that comes in, we're the first line for any student experience, an asthma attack, when a teacher calls and they think the kid's ill, or even when a parent calls. We have so many parents that call us in the morning and say, "Hey, I'm sending the kid to you. They just got off the bus and they're not feeling well, but can you look at his throat?" Like, we're definitely that position that they can rely on us to be that first line to say, "Hey," and they trust us. They trust our knowledge. So, and especially in rural districts, because there's a lot of rural districts that don't have a lot of healthcare, and we are their healthcare.
Gotcha.
They may have maybe a Band-Aid shop, maybe which is an urgent care. but no hospital, no primary care that they see often. And that's what we're trying to do is
Right.
when we see a kid like that, we're trying to bridge that gap and say, hey, man, maybe they should see the primary care, once a year, just a visit. It's free. It's, so we're trying to make those kids healthy so they can come to school.
Absolutely. Eli, how about from your perspective?
I would agree with that.
Yeah.
I mean, whether you're in a small rural district like Kelly was, or in a rather large suburban district like I came from, we are connecting healthcare to education. You think about those. I mean, imagine those schools that don't have a school nurse, right? There's upwards of 60 or so schools in Missouri that don't have school nurses.
Right.
Schools or school districts, Kelly?
School districts.
So there's about 11%
Okay.
of districts in Missouri that don't have school nurses, right? So think about that scenario, right? Like, who's managing emergencies, but more so who's managing the non-emergencies, and how many kids are being sent home because of an inability to manage a situation. So we are that frontline care that can manage situations and can keep the kids at school as much as we can get them home and get them out and seen by medical follow-up. So, barriers to health should not be a barrier to education, right? So if you have a school nurse in place, that nurse is able to manage situations, to communicate with families, connect families to resources, and the goal is to keep kids in school, right? So, school nurses are critical to connecting kids to healthcare, but also keeping them connected to their education.
Yeah, I'm going to ask you both this question, and it's something that, again, I've been doing multiple podcasts for the last 4 years with some school nurses. And one of the things that I think is really interesting, especially for maybe administrators or parents to hear, we know that we've seen a big increase since COVID with mental health. And I know sometimes you might be dealing with a mental health issue, but you're dealing with it from something physically going on with that student. How do you guys like handle that situation where someone's stomach doesn't feel good, or they're having kind of a panic attack, and it has everything to do with kind of their mental health aspect, but yet they've got some physical symptoms? I'll start with you, Kelly. How do you guys deal with that, or work with that situation? Because to me, it would seem that'd be somewhat tricky.
Yeah, I think you start to look at trends. When are they coming in to visit you? What time of the day? Are they getting over it quickly once you've talked to them?
Yeah.
Is it truly an illness?
Right.
That's in the stomach, a virus? Is it something, or is it really just avoidance behavior? And we see a lot of that in schools.
Yeah.
They're avoiding a child, they're avoiding a situation, or they're just not comfortable. And we have found that we want to make this the safest place possible, because sometimes they don't have any place else but school to be safe. So if we can connect them with somebody, and some schools don't have social workers or counselors.
Right.
Sometimes we are that too. So we're doing all those performances too. But yeah, we're just looking at trends, looking at what we can do to calming techniques for them. Do they need just a safe space for a few minutes just to collect themselves and then move on to the next thing? So.
And with that, Eli, what's your take? How do you handle that situation?
Well, I mean, I think that's a very real, very everyday, multiple times a day situation that school nurses are dealing with. And it's happening more and more, right?
Yeah.
So this is not like leveling off yet. So before, when, like Kelly was saying, that parents trust us, right?
Yep.
That we're that connection to healthcare. Go see Nurse Kelly, go see Nurse Eli in the morning and check in, right? Parents trust us, but the kids trust us. And that's a really important part of the job of school nursing, is realizing how much you may not feel it, but you matter to the kids.
Right.
Being there as a constant every day matters to the kids.
Yeah.
So I'm reminded when you were talking, Kelly, I was reminded of a story that a former superintendent told me about a family whose child was missing. They woke up that morning and the child was missing. And I can't remember all the specific details, but they called the schools, called the superintendent, and he proceeded to put a team together that they were going to like put a plan in place to help them find the student and all this. And so they got past like the first bell of the day, and then this plan was going to come into place. And then the superintendent thought for a second. This was a story from when he was a principal. And he was like, "Has anybody checked first period?" And sure enough, the kid was at school.
Wow.
Period. Because as Kelly said, school is a safe place.
Right.
So the student had not been doing well mentally, right? He had left a note. He had, stated certain intentions, right? And then they couldn't find him that morning. And he was in first period. Why? Because school is home base, right? School is a place. So I think when school nurses realize, when you get down and the job is a struggle and it's, you start feeling that weight of the job, right?
Right.
Kids know you're going to be there. So that's truly important. You got to kind of pause and think about that. But I agree that the mental health situation lands in our offices, right?
Yeah.
The teacher needs it out of the room.
Right.
So it lands with us, and then we kind of start triaging the situation, and maybe we loop in so maybe they have a caseworker in the building. Maybe we loop in the counselor. Maybe it's a call home. But mental health is health, and school nursing is managing students' health. And mental health shouldn't fall on some sort of different plate. It shouldn't be some tangent, right? It's in the list of stuff that we deal with.
Right.
And it lands with us first. And it means a lot to be there for the kid to know, the student to know that you're there. And for you to kind of put those steps in place to like, hey, you're safe. Let's talk about it and let's find the next step. But mental health is health, and very much a part of what we do. I would say it borders on a lot of what we do.
Yeah, I would just think so. Again, like I said, 4 years of podcast, especially with school nurses, especially with counselors, even just a different variety of healthcare professionals. And this topic comes up a lot because we know since COVID, these numbers have just skyrocketed through the roof.
Yeah.
But a lot of times they'll show themselves up like, oh, I don't feel good, or my stomach, or my head, or I got a headache, or whatever the case may be. Now, I just want to kind of shift a little bit to the lighter side, because you were talking about building these relationships. What is one of the most commonly asked questions students ask you? And Eli, we'll start with you.
Oh my gosh.
What do they ask you?
Well, they often ask, why am I not a real nurse?
Okay.
Or they call me doctor. Well, they used to.
Oh yeah,
the doctor. You tell mom there's no doctor here.
Yeah.
Yeah.
Wow. So you got the extremes of like, you're not a real nurse, and yet some will call you
But
doctor.
they think you're a doctor. Yeah. Why aren't you a real nurse? Okay, thanks. Thanks for that.
Oh my gosh. Kelly, how about you?
Man, I don't know. Like, I think one of the best things about the role of a school nurse is, and this is cheesy, but there's something about a kid running up to you in the middle of Walmart or screaming, "That's my nurse! That's my nurse!" Like, and they can't believe that you're in the store shopping like a normal human being. Like they don't, like you're like Santa Claus in their world.
Well, they never see us eat, so there's that.
Oh my gosh.
We never get to eat lunch.
Yeah.
That I got to tell you, I've done so many podcasts, but when we were just doing the prep last week and you were telling me all these stories, I'm like, what a job with the highs, the lows, right?
Oh yeah.
I mean, obviously many highs, but also, just some of the things that you face. And we're going to get into that as we unpack, as we go into our next segment. And Kelly, I'll let you kick us off. But I know another thing is that I know with school nursing now more than ever, concern with and really a focus on data that drives impact. So the first question we're going to have to ask is, hey, what kind of data do you all look at? And then when we talk about drives impact, what impact are we talking about? Kelly, we'll start with you first from that perspective.
Yeah. So the data that we collect is, again, full encompassing. So staffing reports. So that tells us how many healthcare workers are working in schools. So that's school nurses, that's health aides, that's your lead contacts, that's your, all that staff that report to us. Then you go into chronic diseases.
Okay.
So everything that we, there's over 80 that we track. Wow. And then there's student encounters. So student encounters is who the nurses have seen, who they've returned to class, who they've returned home, and how many emergencies they've had. So that tells us a lot. That number is astonishing when you get it, because the amount of kids that we see and then return to class is in the 95 percentile. Like 95% of the kids that we see, we return to class.
Wow.
If there's no school nurse there, then they usually go home. So it could be something as simple as you have a headache and they just call the parent, they come pick them up, and they've lost a day of school. So that information is super impactful for us when we get those numbers, and just seeing how many kids they're seeing throughout the year. It's in the millions. It's in the 6 millions. So
wow.
And then each student, we help with screenings. So every school takes on screenings themselves. So they keep all those numbers. They screen a certain amount of kids as far as grade level, and then enrollment if they have a new kid that comes in, because we're never too sure if that kid got screened at their last school because they might not have been there long enough.
Right.
So they handle all that brilliantly. And yeah, the data is super important for us because we can see what is up and coming in as far as diseases. Has anything changed? Has it gotten worse? What do we need to focus on this year? What kind of PD do we do? That's all based on the data that we have.
Gotcha. And I know this, that one of the things that you guys are required to do, right, is the reporting statewide data. But what I think it's interesting, and you alluded to this, but I want to bring back that whole mental health theme, is a lot of it you're looking for those trends in chronic disease, which Kelly, you talked about, mental health, and then always the injury prevention. So I think it's really interesting. Again, you got your chronic disease. You said there's over 80 of them that you track, but that mental health piece is in there. So Elan, when we talk about the mental health, how are you tracking that data, or what's required for the reports that you need to maybe generate?
So under mental health, I believe we are tracking ADD, ADHD, OCD,
ODD,
obsessive compulsive disorder, defiant disorder, depression. What am I missing?
PTSD.
Oh yeah.
Anxiety.
I'm sorry. What'd you say?
Anxiety.
Anxiety. Yes, we're tracking anxiety.
And then bipolar is in there, I believe, also.
Yeah. So we're getting into some pretty specific areas of mental health, and we watch those numbers. And like Kelly said, it speaks to what school nurses are seeing every day.
Right.
It begs the question: how are you managing these very severe mental health conditions for these students? But as Kelly said too, it does target our professional development that we offer as a program within DHSS. So Kelly and I work within the school health program of DHSS.
Right.
And we put a webinar on almost weekly. So data like not just the health conditions, but when you look at mental health, it speaks to the programs, the webinars that we put on, and try to bring educational and professional development to school nurses and school health staff. So, tracking mental health, as I said, it is health. We track it like we track, food allergies. We track it like we track diabetes, right? We don't really discriminate. Like it's in the list, as I said. So, but it definitely helps us to watch the trends, and see how our kids are doing, right? So there's that famous book. I can't think of the author's name, but How Are the Children? I think is the name of the book, right? I wish I could remember the author's name. But this data tells us, how are the children? How are we doing as a state? Where do we need to put our resources? How can we support school nurses, school health programs, and how can we speak to the importance of this profession, of this professional profession?
Right.
How can we speak to it, especially to the districts that don't have school nurses? What's the why behind that? What's the why behind that? Why is there not a school nurse in your district? And when you start looking at this data, it lines up a pretty nice justification toolkit for the profession and the importance of the profession. As they said, these kids, these students tend to get sent home because there's just no other option, and nobody wants that. The school doesn't want that. We want the kids to stay in school, right? So even in a mental health situation, okay, maybe they need, let's follow your plan that we've created, right? Let's get you to your caseworker, or let's get you over to the counselor, or let's do your cool down activities, or let's follow your steps or your plan that we've worked through. Like, let's manage this little piece of your day.
Yeah.
But let's stay at school, if we can. And the data tells that story, right? Every number is a story, is a child. How many kids with diabetes in the state, right? That's a number, but each of those numbers is a person. And it's a person who can stay at school because of the work we do and the supports that we have in place. So it's easy to get lost in numbers, but every number is a person.
Right.
A person's a person, no matter how small, right? So.
Well, yeah, what I want to do now, we've got our first comment coming in, and you guys might know this person. Do you guys know this person? I take it that you do. Okay. Well, she happens to say school nurses could write novels on what goes on in the office. Ha ha. Anything you want to add to that? I think it's pretty cool, actually. It's a good comment.
I think it's pretty funny. So the district I worked in, we had like a Google Doc, and we wouldn't put any names on it or anything, but it was all the funny stories or the funny questions that kid asked us in a thing. And we said one day we were going to publish it because I just go to read it. When I was having a bad day, I'd go in and read it and just laugh because, they ask, just funny stuff happens in our office. Funny stuff.
Mm-hmm. Yeah.
Well,
sometimes students come in and especially the littles, right? And they'll say something and you're like, I know you didn't just say that. And so it's like, okay, tell me more about that,
Oh my gosh.
You find out that it's not at all what they said, So, no. Okay, well, absolutely correct that you could write a book.
Exactly. Well, again, if you're live watching, feel free to put in your comments or questions. Obviously, we'll bring them on the stream in real time, here on the broadcast. All right. So, Kelly, this is a question I think there's some people wanting to hear answered. And obviously, you've talked about kind of what we've been doing or what you've been doing, really. Now, what are maybe some new data points you're looking at maybe in 26 and beyond? Now that you've used some data, now you've got some new metrics or KPIs in my world I like to talk about, right?
Yeah, KPIs.
And look at the KPIs. Where are we pivoting to based on some of the historical data you've seen, and what new data might you start collecting moving forward?
Yeah, so some of the new data that we just started this year was the alpha-gal syndrome. So everybody in Missouri knows that is a hot topic right now. The state is really wanting to look at and get some data about alpha-gal because we are like literally in the hot spot of it. Missouri, with all the forests and the rural areas and the hunting and the people are getting it and getting diagnosed with it, daily. So we're kind of wanting to know and educate the nurses also because some of the alpha-gal they have life-threatening allergies.
Right.
It is gastrointestinal, but some of it is life-threatening, and it doesn't present like a normal food allergy. It's not fast acting. It can take 4 hours and they have a reaction. So we're going to be doing more of that education based on that initiative and the numbers that we're seeing. So.
Okay. And Eli, from your perspective, what is something that you're looking to literally come alongside nurses in your role as a consultant? What are some of the newer data points that you're considering or training nurses on?
Well, I mean, just coming into this role this year, I'm just loving digging into the data in general.
Yeah.
I still refer to Kelly a lot, like is that school districts, but I am amazed at not only the data that our department collects, but at the job we do of compiling it and making it meaningful and rolling it upstream, to those parties above us who can really look at those numbers and consider supports and resources and tools,
Mm-hmm.
resources and tools, across the state. I'm just loving having access to this side of the data, quite honestly. Like it's been I'm like, really, that many? Like it's been a to get a better understanding of what's happening in the state, and it educates me on my role. But specifically, like to bring one new health condition in the list this year, alpha-gal, right? It sounds like, oh, you added the health condition. No. It's a huge step to bring another condition into the list that we're asking for numbers on. So there's a lot of work behind the scenes to just simply adjust the paperwork, but to be able to start talking about alpha-gal in Missouri and representing those numbers to the state is huge, because it is truly a growing health condition. Diagnoses, the number of diagnoses are going up, and we can do so much more as a school nurse if we know what you have, right? So as Kelly said, we might be looking at a situation that looks like a severe allergic reaction, but we can't find a causative reason. Well,
right.
They haven't even eaten breakfast yet, right? And you're thinking, oh, food out, and they haven't eaten, right? So, it helps us to, like Kelly said, 4 hours later, these things can happen. So being able to bring a new condition on board and tell school nurses that, hey, this is another thing on your radar, and it matters.
Right.
If you're seeing this, now you have this information, and that we can start asking this question of, hey, have we considered this? We don't diagnose, but we assess and we ask questions.
Right.
So, but truly, I'm loving this new role, because, I mean, like Kelly said, it's been amazing to get the numbers in. We have,
right.
I mean, darn near 99% of the kids represented in this year's school data. The school nurses have done an amazing job submitting their data this year.
Yeah, seriously. Big applause on that. Yeah.
Huge.
Yeah, huge.
Perhaps we should apologize for the little bit of pestering that we do. But it's well-intentioned. We love you. We love because we love. But if the more students we can get into the data, the more we can represent the work that school nurses do and what they take care of every day. So it's just
and Missouri's on the top. If you look at the whole United States, we are definitely the top people that collect data, and it's not mandated. So that's huge.
That speaks
to states that collect like 65%, and we're like 65. We're trying to get 100% every year, and we're so close.
Yeah.
So
yeah, and that speaks to Missouri's school nurses and school nurse leaders committing to the importance of this data collection, right? Like, we can't do it without them. It's not required. It's requested. So they must be seeing the value in it,
right.
Submitting the data. So, as I said, every number on that line is a person. So,
Well, I want to say this only because I hosted this show about a year ago, maybe a year and a half ago. I certainly want to talk about the great work that Marge was part of. I know you guys were too, but talk to us about the resource that Missouri created. I mean, really to be a first of its kind. I know other states are now following suit, but talk to us a little bit about that tool and why it's been so significant to really help the profession of school nursing here in Missouri. Kelly, we can start with you.
Yeah. So, we try to get as many resources as we can to make our school nurses the best because, we're Missouri and we want to be the best. We're the show me state, so we show everybody else how to do it.
yeah.
So yeah, we're always trying to create new things that will make their life easier, that they don't have to look up every single time.
Right.
It's a toolkit that is there, it's accessible, it's ready to go. They don't have to think about it. All they have to do is put in what they want and it's good to go. So we're always trying to be the best.
Mm-hmm.
Yep.
Absolutely.
And then Eli, I know now you're part of that team because I know the legend herself retired, which was a sad day for all of us. But at the same time, we know that you've come in, and now that you've seen this new toolkit, how do you see it? How do you see your role fitting into that now as you move forward with just trying to continue, getting it bigger and better?
Yeah, no doubt. Marge Cole was amazing in the role as Missouri State School Nurse Consultant for a number of years, and built a tremendous program, with the team and the people around her. So big shoes to fill, but I'm hoping my shoes will grow. So it's truly an honor to come into this position and try to build on the program that was established, before me. Every day I learn more about what the program does and all the resources, and it's exciting for me. When a school nurse emails in a question, I'm like, whoa, all right, let's find the answer, right? So and then I dig deep and I find all of our resources. The school health program with DHSS it truly is amazing. From manuals on how to manage a school health program, screening manuals, pregnancy guideline manuals. All sorts of all school nurse skill manuals. Like you should hop on just for funsies. Like, we have so much stuff available to school nurses, and it's just kind of a matter of opening their eyes to making sure that they know we exist. And that's really the goal. Like I said, we're here to help the helpers. And it's really about letting them know who we are, that we're available. We're not gonna come in and judge your program. We're not gonna, we're not we're gonna come in with our little checklist. Are you doing it right? No, we're like a drink at the nurse's station. So no, that's not who we are. We're not joint accredited.
That's a myth about us, is that we learned at our health office orientation. Is they thought we were some sort of regulatory organization that came in and could shut them down, and we're like, no, we're not that at all. We are the dynamic duo. We're here to just everything. We want to help your office. If you're struggling, we want to help you. If you have something great to show off, we want to be there. Right. We want to celebrate it. We want to make sure everybody knows about it, because if they know about you, they know about us. We're just trying to build the program into something spectacular. And
I called a school just last week, on our hunt for data and for reports, and a very, very nice woman answered the phone at a school. And I said, hey, I'm Eli Brueggemann with the Department of Health and Senior Services. I'd like to speak to whoever is in charge of your school health program, whatever. Long pause. And she goes, uh-oh.
Oh, my gosh.
And she goes, that's me. I go, you're not in trouble.
Yeah.
So, Kelly's right. Like, they hear that title and they're like, oh, no. And really, it was just like, hey, I just wanted to tell you how to access the website.
Right.
The program is truly amazing.
Yep.
And as I say, if it's just for funsies, hop on and see how much, whenever we get the chance to connect with the school nurse, answer a question, offer some supports, we always link in the resources, and we always say, this is here for you, specifically this part. And they're just like, oh, that's amazing. I didn't know. So I'm like, well, that's why we're here, right? So we're not going to come in with a checklist,
Right.
The program is truly amazing. It has been, it has been built up into something, this an amazing resource. There's not a big enough word for it, but I'm thrilled to be in the role, and I hope to do my are proud. I truly do. So,
well, I'm just gonna throw this up now because if for our viewers, if you're looking at this, is just one place. I know you can certainly go directly to the DHSS website as well. But at Missouri Healthy Schools, I can just tell you this: we have a plethora of resources, particularly associated with school nursing. This is why we host these podcasts, because one of our big roles is in MHS is we want to get you those resources. And I know it was one of the most memorable podcasts I was ever part of. I know you guys were too, but it's fascinating how that has just grown. And again, it was so cool. Like Marge kind of like, having that birthing that newborn, right? I mean, with all the amount of time and work, energy and effort that went into that rollout, and then getting some kind of, national recognition for it, for being so robust and complete. But again, this is what we do at Missouri Healthy Schools. You can check it out on our website. If you want even more detailed information, certainly go to DHSS as well. But this is a great place for you to go. This is something that we take very serious, and we're constantly updating in real time our resources here at mohealthyschools.com. So with that, we're going to wrap up on our third and final section. And ladies, I cannot lie to you, this one excites me the most. And here it is. The human side of school health. Well, first of all, what in the world are we talking about, the human side? Do you really think there's a human side to this? And if so, what it is that, Eli, kick us off. What are we talking about here with the human side?
The human side of school health, we've alluded to it already, right? Like, to quote Dr. Seuss, a person is a person, no matter how small, right? So everybody's feelings matter, right? Whether they're 5 years old or 18. So kids are people, and the fact that they, like we said, the fact that they know that we're there, they know we're going to be there. There's a human connection with these kids. Sometimes they just need to pop in the morning and say hi. I had some kids that I was like, you don't need a nurse pass and to fake a boo-boo. Why don't you come in class and just say hi, and we can have a little connection then, right? They just need to see you, right? You're kind of like mom, kind of like dad at school. You're that person they can go to that can just be like, you're okay. Even we need to know we're okay, right? So, it's not just get them in, get them out, right? It's connection. Whether you're just sitting with a student, teaching them how to take their blood sugar, right? Teaching them how to deal with their pump, teaching them how to deal with their glucometer. At elementary level, my role was when a child had a chronic health condition, for example, like diabetes, that by the time they left me and got to the next nurse, they were self-sufficient. So from 5th grade to 6th grade, I expected my students to be able to play a role in managing their health condition if they were able, right? So whether that's dealing with maybe their ostomy, or dealing with their diabetes, or knowing when they have a migraine coming on, or whatever it might be, we work with kids and we put plans in place with nursing goals, just like care plans in the hospital, right? We write care plans and we set goals for kids, and we help to support them to achieve those goals, to be able to manage their condition, or at least be to speak for themselves. This is what I'm feeling. This is what I know I need to do. So, it's never a diabetic. It's a student who has diabetes.
Mm.
They're a person first. They're a condition second, third, fourth. So, we have to remember that, what kids are telling us is the reality they're experiencing.
Mm-hmm.
So, no, you're fine, but okay, I hear you. Let's take a minute. Do you think you're okay? I think you're okay. Like, let them own some of their feelings.
Yeah.
That's how I see the human side of taking care of the kids anyway.
Yeah. Kelly, your thoughts on that topic?
Yeah, the human side for me is, the going home at night and worrying about that child that told you they were hungry before they left, or
yeah,
came to school and didn't have a coat and it's 20 degrees outside because their older brother took it and that's the only coat they have. And
right.
those are the things that keep you up at night. And this job isn't just like a clock in, clock out. This is your life. You put everything that you have into it.
Right.
And because you may be also a parent, that has kids in that school, and you think, I want every child to be like mine and have everything. And when you don't see that, you're crushed, and it takes a toll on you. And school nurses are built tough because we carry a very heavy load on our shoulders every day, and we take it home every day, and we think about it all night. And we wake up the next morning with a solution, or trying to figure out what we can do for that kid that day. I go through my closet and get a coat. I find a pair of shoes. I go buy a pair of shoes. I can't tell you how many pairs of shoes I've bought for kids.
Yeah.
Because I couldn't take their shoes anymore. And every kid deserves to have a pair of shoes that tie and don't touch the ground and aren't wet. So that's, and the waving in Walmart, that gets me. I have been gone now for a year, and kids still come up running and screaming, "Oh, it's Nurse Kelly!" So it's the greatest feeling. It's what makes you get up in the morning and go to work. And if you have a bad day, it's what gets you through. So
yeah. All right, I'm going to take it a little on this lighter side, but really the true human side here. And Eli, we'll start with you. I want to know at least 2 skill sets you have developed in this role. Okay, because I'm sure there's some things you've had to learn how to do that was not part of your job description when you signed up. It certainly was not part of your official nurse training. But talk to our audience right now. What are some skill sets that you've picked up in your role as a school nurse? Because they are absolutely hysterical.
Okay, so I don't mean to brag, but I am probably a champion lice catcher.
Okay.
So, I don't have the trophy behind me, but I'm telling you what, I'm good at catching lice. And, I don't know whether that's something to brag about or not, but, sometimes parents need a little proof of what you've taken off their child's head. But it's also a moment for education.
Yeah.
To be able to tell a parent, this is what you're looking for when you look at your child's head.
Right.
So here's how you do it. So you get you a roll of Scotch tape, right? And you pull off 3 little 2-inch pieces of Scotch tape, and in true IV insert form, you lay your tape out, right? And your 3 little things. So and then you get your child, and if you got to get up on a stool, that's fine, and you start your looking. And you dig through, and you get behind the ears, and you get down at the base of the neck where it's nice and warm and toasty, where they like to live. And then it's like once you see one, you see them. It's like when you see 1 ant, then you see 100 ants, right? So once you see them, you have to be really still because you don't want to. You're trying to get them to come to you. So you get you your tape and you watch, and then once you see one, you bam, and you pop that tape right there on their head. And you get that little louse right there on the Scotch tape. So I would take that and I would tape that down on the nurse note, and I would put additional pieces of tape around it, and stick that in an envelope. And when the parent came to pick the child up. Usually they would come pick them up. We didn't send them home, but once they knew there was lice involved, they would tend to come pick them up so they could help take care of them. And you would show them that, and you would be like, this is what you're looking for. This is what I pulled off your child's head, right? So when you go home tonight and you look through their head and you look on their scalp and you're looking for this is what it looks like. Because who's seen a louse, right? So that is something that if you need a lot. Okay, so there's that.
Okay.
And also, I am not what I would call a good seamstress, but but if you've got a pair of leggings with a hole in a spot where it shouldn't be, I could work a needle and thread. It wasn't pretty, but if I didn't have like spare pants for them, I figured out how to close up elastic fabric. It wasn't pretty though. Like I'd be like, I'm really sorry, but there you go. So yeah, so I'm more proud of the lice catching, and if you need a louse caught, you hit me up on my email. Give me a call.
What are you talking about? We're just going to give you 800 hotline here. Come on.
I'm not scared. Yeah. I mean, my friends at work couldn't believe it, but I got, look at what I found.
Wow.
No.
All right, Kelly. I know. Here we go. What do you got? What are a couple of skill sets that you've developed in all your years of being on the front lines?
Well,
working with students.
I don't know if Eli learned this in nursing school, but apparently this is something that was taught, that you reinsert the string back into a hoodie. I've done that multiple times as a school nurse. I didn't realize that was a skill that I needed, but apparently it was. And then I can tape up some mean shoes too, and the glasses. Oh, like right here, just taping right here. It never works, by the way. It never works. Just call parents, tell them to get new glasses.
Oh my gosh.
Yeah. That's just the tip of the iceberg. Every day is a new skill. I would love to hear from
a new
our
skill.
audience. There you go. Yeah, I would love to know what all new skills have you all picked up?
Yeah, if you're watching this live, you know what? Feel free to drop a comment or two. We'd love to hear what skill sets you've picked up. Because I got to tell you, when we were prepping for this show, I just randomly asked that question. I was like, I'm sure there's things you come across that you didn't deal with or was ever trained in, obviously, with, your formal training, but things that you're expected to do, which, but Eli, just how graphic you are with that lice thing. I mean, and sometimes parents not wanting to believe you. And so now you got the proof. And then really what you got to do next, now that you've seen it, that kind of thing.
Yeah. It's a good teaching moment, but it's also difficult to deny. Like, why would I just do this?
Right. No, well, exactly. So guys, as we start to, wrap up, I want to give you guys the opportunity to certainly give your closing reflection. And we do know this, we do know that healthy students are definitely better learners. And I know we've heard that across the board. And Kelly, we'll start with you. What is your closing reflection as we begin to now wrap up this podcast?
Yeah, I just want to say thanks to all the Missouri school nurses and any school nurse out there. You're doing a great job. Mm-hmm. Keep going. If you ever need anything, Eli and I are always here. We're always ready to help anyone. Whether you're a small school district, a large school district, we don't care. We're from both backgrounds. We got some shared skills. We get along very well. We love long car rides in the car together. So if you need us to come see you, we'll come see you. Again, anything that you need, we are always available for you.
Yeah. Eli, what's your reflection?
I would agree with that. I would say, something that I've always said throughout my various sort of like leadership positions as a school nurse, that we see you. We see you. You matter. We see the hard work that you're doing. We see that you're not being invited to meetings. We see that you're not being asked your opinion. We see that things are happening without you being included. We see that teachers might know about a condition that you don't know about. You know, we see you. We see your struggles. We've done the job, and it's a privilege to help the helpers. It's a privilege to try to speak for you. It truly is. It warms my heart to be able to be at this point in my career where I can turn around and help the people who are in the role that I did. So, you know, as Kelly said, the work you do is so important, and you're so valued. And if you don't feel it, please know that we feel it for you. We appreciate everything you do on a daily basis. We're always here for you. And we see how much you love, and we love that. So we're always here for you. Don't hesitate to reach out. You're important. The work you do is important. Your students are important.
Absolutely. And with that, I want to throw this up one more time. As we say all the time, Missouri Healthy Schools, part of our function and our role is to get you the resources that you need. I know there's been a few resources that have been talked about on this podcast. Feel free to start here. For additional resources, certainly go to the DHSS website as well. But I can tell you what you need, we have, especially in Missouri. Kelly, I liked how you talked about how Missouri is #1 in reporting, the highest percentage of data. Again, big shout out to all the nurses, yes, for providing that. And also the tool that was just, launched a little over a year ago that Marge was part of, is kind of her, legacy, if you would, with that storied career she has had. I know, Marge, you've left an impression on all of us, well into your 80s, and it's just a lesson for all of us just to see why did she do it that long? Well, it's because of the love and the passion she had for the people, and yes, the students. That's why she was doing what she was doing. And Eli, it's so great to see you now in that new role, bringing your, passion, energy, experience as well, to just continue to help refine and get us to even higher levels, as we move forward in this area. So I just want to say thanks to all of you for watching tonight's MHS podcast. You can certainly catch the replay. It airs immediately as soon as we finish this podcast. And in case you're wondering, what is our next podcast? We are actually going to continue. I believe this will be starting our 5th year on podcasting. We know that January is Mental Health Awareness Month, and I know that Lisa Durking and some of her friends and colleagues, I just know that it's always been a very popular episode that we put on, and certainly we'll be doing some deep dives and certainly lots and lots and lots of resources as we talk about the latest in mental health and certainly some of the tools that we're providing here in Missouri for all of you. So that's going to be our next podcast. And again, I just want to say such a huge, huge thank you to our guest. Kelly, it's always great having you on. And Eli, I don't know if there's anyone who's more energetic than you. I got to tell you, I think you might be the only guest I've ever had that has been standing the entire time. I know that's your thing. I mean, I love it. Exactly. I mean, you're a moving target. I love that. But I just, ladies, I love what you're doing. I just know that it always starts with your whys. You have 2 of the strongest whys of people I've ever met as guests. And I just want you to just keep shining your light as bright as you can and keep having that impact on our nurses, because ultimately it's all about our students.
Yeah.
And like I said, in my role and our role here at Missouri Healthy Schools is to help with that promotion of that, help get as much notoriety to it. Again, Eli, for your sake, let everyone know that you're not the nurse police here whatsoever. That's not your role. Your job is to support, come alongside, do some professional development, certainly collect some data, share some data, those kinds of things. And ladies, this has been a fun hour that we've had together. And Kelly, any last thing you'd like to say?
We're the best team. We're going to do this.
I love it.
Stuff going this year, and we're ready.
Show me state.
Yeah.
Okay.
Love you guys. Thank you so much.
All right, gang. For Kelly Vaugh and for Eli Brueggemann, my name is Dr. Guy Danforth. I want to thank you for watching all right here on the Missouri Healthy Schools podcast live. We'll see you next month for another streaming podcast. Thank you all and good night.
Bye, guys.